you know what 22q is?
I have no idea.
Do you know what DeGeorge syndrome is?
Nope.
So you wouldn't know what effects it has either? Do you know anybody with DeGeorge syndrome?
Nope.
That's not true. Yes, you do. Because my brother has 22q, also known as DeGeorge syndrome. And this is my informative speech on DeGeorge syndrome. My main points that I will be discussing is when was DeGeorge syndrome discovered and by who, how DeGeorge syndrome is caused, and what are the effects, treatment, and probability of DeGeorge syndrome. Let's go on to when DeGeorge syndrome was discovered and by who. DeGeorge syndrome is a syndrome in which part of the chromosome is missing from the rest, but we'll get into more detail with that a little later. Let's talk about its discovery. Next slide. Many people across the country, little kids in fact, were all having similar symptoms to a disease or sickness that no doctor had ever seen before. However, Dr. Angelo DeGeorge was the first doctor in the world to diagnose the collection of these findings in patients with similar symptoms. He was and still is an endocrinologist at St. Christopher Hospital for Children in Philadelphia, according to the Dr. McDonald McGinn and Dr. Zakai's article, The History of 22q 11.2 Deletion. Dr. DeGeorge's discovery came in the early 1980s. How is DeGeorge syndrome caused? Let's start with some basic biology. When conceived, a fetus gets 23 chromosomes from each parent, giving him or her a pair of 23 chromosomes. DeGeorge syndrome is caused by the deletion of part of one of the child's 22nd chromosomes. This specific piece of the chromosome that is deleted is known as 22q 11.2, which would be this green section right there. The deletion of these 30 to 40 genes in the chromosome occurs in one of three stages: in the father's sperm, in the mother's egg, or it happens in the early stages of fetal development. Now, you can't always be sure which is the root cause of this, but it has been narrowed down to at least these three. In my brother's case, the deletion occurred in the early stages of fetal development, as both of my parents were tested afterwards. There was nothing my parents could have done, it was just something that happened. There is a debate on what the chances are of an adult with 22q is of giving this syndrome to their offspring. According to the Mayo Clinic, a parent with 22q is not likely to give the deletion of the 22nd chromosome to their offspring. However, the National Health and Service says that 50% chance of retracting the disease is possible from a parent with 22q. Now, maybe not likely to the Mayo Clinic is 50%. We aren't sure. What we do know is that the NHS believes it is a 1 in 2 chance. There is nothing that can stop this deletion, at least as of right now. There's no way to prevent this syndrome other than just to not have children at all. Let's move on to some other effects. Complications that may come from DeGeorge syndrome include heart defects, hypothyroidism, thymus gland dysfunction, a cleft plate, distinct facial features, learning, behavioral, and mental health problems, autoimmune disorders, and a relatively short stature. My brother stands at a whopping 5 foot 3 inches and has many of these effects that were just listed. Sadly, there is no cure for 22q. However, with today's technology, I hope it's not far away. Although most people with 22q can do is have regular hearing tests, blood tests, heart scans, and regularly measure height and weight. Testing their mental ability through tests is a basic way to check if they have a learning disability caused by 22q. Speech therapy is another treatment in order to help those with DeGeorge syndrome with communication skills. My brother, for instance, can't technically form consonants, so he just uses the vowel sounds. I have gotten pretty good at speaking in his language, as I call it. Medication is usually prescribed as well. My brother takes 4 medications in the morning and 5 every evening. The chances of getting 22q are less than 1 in 100 people. That's less than 1%. However, my brother was one of those less than 1%. Nothing my parents did affected that. It just happened to Caden and had to be part of his deleted chromosome. DeGeorge syndrome is a rare syndrome that no one can prevent. With this deletion, there's nothing anyone can do. At least nothing anyone can do right now. With no cure, most people with DeGeorge syndrome are still expected to live a long life. Assuming they get proper treatment, there shouldn't be any reason why they can't live a normal length of life on Earth. That's very reassuring for me. I don't know what I would do without my brother right now. A story that I like to tell people is when my mom met with one of my brother's doctors for the first time right after his birth. She asked the doctor who was prepping to go into surgery with him, "Do you believe in God?" He answered right back at her and said, "Ma'am, I couldn't do this job if I didn't. Thank you."